Welcome to Boston Community Health. I'm Dr. Elias Thorne. In medicine, there is one specific condition crowned as the mother of all diseases. It does not strike instantly, but silently destroys your entire body from within. That underlying monster is type 2 diabetes. Most older adults mistakenly assume that high blood sugar merely represents a minor dietary issue, completely unaware that chronic insulin resistance is transforming their entire bloodstream into a thick, toxic fluid. As you navigate middle age, the excessive accumulation of glucose molecules inside your vascular framework acts exactly like a chemical acid, silently eroding the endothelial lining throughout your entire body. Diabetes does not assault a solitary, isolated organ. It destroys the primary transportation network nourishing your cells. Your smooth, non-stick endothelial cells become microscopically scratched, chronically inflamed, and lose their natural elasticity. This widespread cellular degradation creates the perfect environment for cholesterol plaques to easily adhere, narrowing the arterial lumen over time. The very first catastrophic complication of this master disease presents as devastating ischemic brain strokes. When the major arterial pathways delivering blood to your cerebral cortex become atherosclerotic and progressively narrowed due to chronic hyperglycemia, the vital supply of oxygen and essential nutrients toward your neurons drops drastically. A single microscopic blood clot developing over a damaged arterial segment can instantly occlude a cerebral vessel, triggering a massive territorial stroke, stripping away a senior's independence. This severe insulin resistance also cuts off vital oxygen flow to your neurons, heavily accelerating vascular dementia. Please click like, subscribe to Boston Community Health, and comment your age below. Next, diabetes directly assaults your cardiovascular framework, hardening the coronary arteries, supplying the heart muscle, triggering silent myocardial infarctions and chronic congestive heart failure past age 60. The myocardium of a diabetic individual forcibly operates within a chronic high-pressure environment driven by widespread vascular constriction and arterial hardening. Persistent elevated glucose systematically destroys the microscopic vessels directly nourishing the heart muscle itself, forcing myocardial cells into starvation, progressive fibrosis, and losing rhythmic contractile strength. Consequently, the weakened heart fails to pump sufficient blood volume throughout your systemic circulation, leaving seniors chronically exhausted, short of breath during mild exertion, and facing sudden cardiac arrest risks. Moving beyond your heart and brain, this master disease advances to destroy your primary blood filtration organ, the kidneys. Our renal filtration architecture is constructed from millions of microscopic blood vessel tufts, clinically designated as glomeruli. When a bloodstream saturated with high glucose continuously forces its way through these delicate membrane filters under high pressure, it tears, inflames, and fibrizes the glomeruli. The kidneys progressively lose their capability to clear out toxins, leading directly to end-stage chronic renal failure. Revision represents another primary target under assault by chronic elevated blood sugar. The tiny capillaries supplying your retinal tissue are incredibly fragile and highly sensitive. Hypoglycemia forces these microvessels to dilate abnormally, leak fluid plasma, or rupture, entirely causing severe retinal hemorrhaging. Your body attempts structural repair by growing fragile new vessels, but these easily break again, creating permanent scar tissue that detaches the retina, driving irreversible and catastrophic blindness. This master disease systematically severs your peripheral nerves, triggering the devastating diabetic foot syndrome. High glucose destroys the tiny capillaries nourishing your nerve fibers, stripping older adults of vital pain, heat, and cold sensations within lower extremities. When they sustain a minor scratch or tiny splinter, the brain receives zero warning signals. The wound remains neglected, combined with poor nutrient delivery driven by arterial narrowing, rapidly escalating into deep infection, wet necrosis, and forcing surgical amputation. To successfully protect your body, you must manage your hemoglobin A1C safely below the 5.7% threshold. Please click like, subscribe to Boston Community Health, and comment right now. A hemoglobin A1C test measures glucose permanently attached to red blood cells over 3 months, helping physicians catch hidden prediabetes accurately. The vast majority of older adults focus solely on tracking fasting blood glucose using morning finger prick devices, and they feel completely secure if those numbers appear within normal ranges. But morning fasting blood sugar fluctuates significantly based on your previous night's dinner or temporary stress, failing to present the true picture of vessel damage. The fundamental biological route driving this master disease is insulin resistance expanding within your body's cellular framework. Insulin functions effectively as a critical medical key, opening cellular doors to allow glucose molecules to enter and transform into active energy. Due to decades of consuming excess refined carbohydrates combined with sedentary behaviors, these cellular locks become distorted and reject the insulin key. Glucose gets permanently trapped inside the vessel lumen, forcing your pancreas to overwork and secrete massive insulin volumes. This state of chronically elevated systemic insulin acts as the most destructive chemical agent, invading your vascular endothelium, triggering widespread chronic inflammation. After years of overcompensating and managing this massive workload, the beta cells of your pancreas enter a state of complete exhaustion and die off, causing insulin production to drop drastically. This marks the chronological point where blood glucose becomes completely unmanaged, officially transitioning into type 2 diabetes and launching the catastrophic organ domino effect. The greatest clinical tragedy is that the vast majority of these devastating complications are entirely preventable through small modifications in your daily biological behaviors during middle age. You do not need to live under chronic anxiety regarding the collapse of your heart, kidneys, or vision. What you truly require is accurate clinical knowledge and persistence to establish clean habits. Shielding your blood vessels during the pre-diabetic stage through nutrition and exercise represents the wisest anti-aging intervention. Core preventive method number 1 to reverse insulin resistance at home focuses on establishing an endothelial protective dietary strategy, cutting down sodium and processed sugars from your daily menu. Method number 2 incorporates utilizing a brisk 30-minute working protocol immediately after meals, stimulating skeletal muscles to draw glucose out of your bloodstream for fuel without requiring insulin keys. When you perform a brisk walk approximately 15 minutes immediately following a meal, the major muscle complexes within your thighs and cars contract intensely. This targeted mechanical movement directly activates specialized glucose transporter channels on your cell membranes, allowing sugar from the bloodstream to flood into skeletal muscles to be burned for fuel. Remarkably, this physiological process functions completely independently, requiring absolutely no assistance from the resisted insulin keys. This represents the most natural medical intervention to clear postprandial glucose spikes safely. Alongside brisk walking, you can implement the continuous stationary calf raise routine right at your dining table or while watching television. As we established, the lower calf muscles function effectively as the body's second heart. When you elevate your heels to their maximum threshold and lower them rhythmically, you do not merely pump stagnant venous blood backward to prevent deep clots. You're consistently stimulating deep muscle layers to consume excess glucose, shielding your vessel walls from this master disease. Core preventive method number 3 to manage chronic glucose involves implementing a scientifically sequenced eating protocol during every single daily meal. Always initiate your meal by consuming a plate of dark leafy greens or fiber-rich foods first. Next, transition directly to high-quality protein and healthy lipid sources like fish, meat, eggs, or nuts. Finally, when your stomach is partially filled, begin consuming your carbohydrates such as rice, bread, or pasta. This simple behavioral sequence delivers an incredibly powerful biological impact. When dietary fiber arrives inside your stomach and small intestine first, it dissolves and constructs a dense biological gel mesh coating the intestinal mucosa. This protective mesh functions exactly like a sophisticated filter, severely delaying the breakdown and absorption of glucose molecules from later carbohydrates into your bloodstream. Consequently, your blood sugar increases in a slow, stable, and gentle curve, completely avoiding dangerous pressure spikes against your endothelium, lifting the immense workload straining your damaged pancreas. This sequence dining protocol represents the most exceptional defensive weapon against prediabetes that anyone can easily perform right from their table without incurring costs. Keeping your blood sugar free from postprandial surges is the definitive key to pulling your chronic hemoglobin A1C back into the safe zone below 5.7%, entirely removing endothelial inflammatory agents, maintaining perfectly smooth vessel walls, and protecting your cerebral vascular architecture from the foundation. preventive method number 4 focuses on strictly establishing and optimizing your nocturnal sleep architecture. Massive clinical research conducted at Harvard Medical School has systematically proven that chronic sleep deprivation, insufficient resting hours, or frequent nighttime awakenings directly triggers your sympathetic nervous system to flood stress cortisol hormones into your bloodstream. Elevated cortisol drastically expands cellular insulin resistance, forcing the liver to dump stored glycogen into circulation, generating dangerous nocturnal glucose spikes. This hormone surge strains fragile plaques, triggering acute nocturnal cerebral vascular spasms. Please click like, subscribe to Boston Community Health, and comment your sleep habits below. This chronic chemical pressure extending throughout the night severely fractures neural fibers, silently stripping away your cognitive clarity. To prevent this, keep your bedroom draft-free, comfortable, and eliminate blue light from electronic devices 2 hours before resting to optimize protective melatonin hormones shielding your brain cells. Preventive method number 5 requires completely discarding tobacco smoking and restricting toxic stimulant abuse. Carbon monoxide gas and nicotine within tobacco smoke function exactly like a dual assassin team. They continuously assault and slaughter your vascular endothelial cells, dropping nitric oxide levels to critical alarms. The absolute moment you discard your final tobacco cigarette, your body's self-healing process is instantly activated, allowing endothelial layers to spectacularly recover their natural contractile flexibility over time. Coordinating these 5 natural preventive methods constructs the most comprehensive protective framework, helping you master your own health destiny. However, to permanently control the silent degradation driven by this master disease, geriatric medicine strongly recommends combining clean lifestyles with regular comprehensive laboratory screenings inside authorized hospitals. A true diagnostic evaluation does not stop at generic tests, but maps out microvascular structures through high-resolution imaging and thorough cardiovascular diagnostics. The primary essential diagnostic imaging process involves undergoing an annual duplex carotid ultrasound evaluation behind the neck. Your carotid arteries represent the singular highway delivering oxygen-rich blood volume from your heart to your entire brain tissue. When chronic elevated blood sugar combined with insulin resistance silently destroys the carotid endothelium, atherosclerotic plaques construct and expand at this segment. A duplex ultrasound allows clinicians to visually analyze plaque architecture, measuring the exact percentage of arterial narrowing for timely clearance. Atherosclerotic plaques developing from diabetic complications usually possess incredibly unstable, fragile, and loose cellular structures. Under the constant mechanical shear stress of daily blood flow, the thin fibrous cap covering the plaque can rupture, causing cholesterol debris to detach and launch directly into cerebral circulation, blocking small deep arteries. This mechanism triggers dangerous silent strokes, producing permanent lichen or infarcts, destroying your frontal and parietal lobes, ruthlessly stripping away a senior's mental clarity. The second essential functional evaluation involves screening for hidden paroxysmal atrial fibrillation utilizing continuous Holter monitoring devices at home. This cardiac pathology causes the heart's upper chambers to quiver chaotically, forcing blood flow to swirl and pool inside, constructing massive blood clots that travel directly upward to occlude brain arteries. The clinical risk doubles when an individual suffers from sugar-induced vascular damage combined with cardiac embolia attacks, generating a catastrophic severe stroke framework with high disability outcomes. The third supreme diagnostic imaging process involves undergoing structural brain evaluation via advanced high-resolution MRI scans inside authorized hospitals. This represents the singular imaging modality capable of exposing and detailing those tiny white scars from lichen or infarcts that silently occurred in your past due to high sugar complications. Standard clinical checkups remain completely blind to these deep neurological injuries. An MRI film allows neurologists to accurately locate white matter degradation to implement early life-saving clearance. To successfully transform today's complex scientific knowledge into a practical protective weapon for your next checkup, I want to provide a concise clinical communication protocol consisting of 3 strategic questions to discuss directly with your healthcare provider. You do not need to live under passive anxiety or surrender your health destiny to an unfeeling automated medical framework. When you confidently present these highly informed academic queries, You force the physician to concentrate on constructing a personalized prevention framework. Strategic question number 1 you strictly need to present to your physician is, based on my middle-aged physical status and current insulin resistance, what are the exact target blood pressure metrics and optimal hemoglobin A1C threshold I must maintain during home logging? This crucial query forces the clinical conversation toward establishing a clear biological milestone, completely eliminating vague guesswork, allowing you to accurately evaluate the real-world efficiency of your daily microvascular movements. Strategic question number 2 you strictly must discuss during your clinic appointment is, given my structural vascular risks from chronic hyperglycemia complications, am I an appropriate candidate to undergo a duplex carotid ultrasound and a brain MRI scan to evaluate for silent lacunar infarcts? This question advances your medical dialogue into specialized neuroimaging dimensions, completely exposing and detailing underlying arterial threats inside your skull before devastating physical complications erupt. Strategic question number 3 you strictly need to ask to finalize your protective shield is, do I require an overnight 24-hour Holter monitor evaluation right at home to completely rule out paroxysmal atrial fibrillation risks? Presenting this complete trio of strategic queries demonstrates that you represent a highly informed individual possessing profound wisdom during your personal journey to safeguard your physical freedom and cognitive clarity across lifespan. Any ethical, highly competent physician will completely welcome these 3 strategic questions from you. They will deeply respect your medical intelligence and appreciate your self-advocacy, because they comprehend that an informed patient represents an exceptional partner during a long-term therapeutic journey. Conversely, if your physician dismisses these questions or makes you feel difficult, that acts as crucial diagnostic information proving that specific doctor is simply not the right fit for your longevity path. Maintain firmness in seeking a healthcare professional willing to listen. The ultimate goal of geriatric medicine at this stage must be protecting your actual quality of life, preserving your personal independent living, your physical energy, and maintaining your capability to do what truly matters. You possess every single right to know exactly what a screening test is looking for inside your body, avoiding an unfeeling automated checklist dictated by an impersonal medical framework. I want to leave you with a profound clinical philosophy of geriatric medicine, the devastating complication you successfully prevent through your intelligence and consistent daily movement will never make dramatic breaking news. A stroke or heart failure pushed back from afar carries no intense resuscitation moments inside an emergency operating room. It remains completely quiet. The beautiful outcome of that wise prevention is just an ordinary morning where your brain stays sharp, your steps remain steady, and you continue enjoying warm conversations with family. Now, let us bring all of today's vital medical insights together into a powerful protective action. We have thoroughly exposed the true nature of this master disease through sugar-induced vascular damage, launching a catastrophic organ domino effect encompassing ischemic strokes, dementia, congestive heart failure, renal failure, blindness, and foot necrosis. This represents a highly concerning clinical landscape, yet it remains fully within your personal control if you initiate behavioral modifications immediately starting tonight. Your 5 natural home interventions incorporate establishing endothelial protective nutrition, brisk walking for 30 minutes post-meals, utilizing the sequenced fiber-first dining protocol, optimizing sleep architecture against cortisol, and permanently discarding tobacco smoking to recover capillary elasticity. This represents your ultimate comprehensive framework to protect your entire vascular system naturally and wisely, successfully maintaining your peak physical vitality regardless of the passage of chronological time across your lifespan. Alongside clean lifestyles, memorize 3 strategic questions during your next physical checkup, asking about your target hemoglobin A1C, requesting a duplex carotid ultrasound, and discussing a continuous Holter monitor evaluation. Write down these 5 methods and 3 strategic questions on a physical sheet or store them inside your phone app to serve as your permanent roadmap for safe movement and nutrition. Share this educational video link with the people you care about most, a spouse living alongside you, an aging parent, or a sibling over middle age who needs this vital screening data. The individuals who are at the highest statistical risk of facing the sugar-induced vascular storm will likely never search for these clinical studies online. Your small act of digital sharing today might become the exact reason someone's vascular system is saved from a devastating future neurological event. Your self-advocacy allows them to preserve their cognitive mind to live an independent Happy life of healthy longevity. I'm Dr. Elias Thorne from the trusted medical organization Boston Community Health. Our professional mission is to deliver honest, international geriatric knowledge without fear-mongering to help you dominate your health destiny. Your brain and cardiovascular system remain completely priceless assets, deserving your highest level of wise protection daily through simple daily habits. Always stay sharp, stay highly informed, and master your own destiny. Within next week's educational series, we will deliver advanced clinical investigations targeting strategies to reverse fatty liver disease, a dangerous companion frequently traveling alongside middle-aged diabetes. This represents a highly critical subject helping you construct your complete metabolic defense network, maintaining your peak physical clarity regardless of the passage of chronological time across your lifespan. Remember clearly that naturally clearing your vascular lumen begins directly from your dining table and your moderate microvascular exercise routines. Today's 5 preventive methods and 3 strategic questions represent the golden key unlocking your active, healthy longevity, lifting the immense workload straining your damaged pancreas without incurring any financial costs. Do not delay another single day. Select just one single action item to initiate directly within your life tonight. We will consistently remain here to deliver the most authentic, scientific, and evidence-based knowledge throughout your health autonomy journey. The compounding effect of these small daily movements creates a highly powerful anti-aging clinical intervention over time, preserving the non-stick integrity of your cerebral and coronary blood vessels. A sharp cognitive mind and physical independence represent your most priceless assets to thoroughly enjoy complete happiness alongside family. Initiate your calf raise routine or brisk walking immediately within your warm, comfortable living room space tonight to actively reverse dangerous cellular insulin resistance. Please click like and subscribe to Boston Community Health right now and leave a comment below about the complication that surprised you most. Wishing you continuous health and see you next time.